My topic was the American Medical Informatics Association, or AMIA. To start off with the basics, AMIA defines informatics as the intersection between the work of stakeholders across the health and healthcare delivery system who seek to improve outcomes, lower costs, increase safety, and promote the use of high-quality services. Overall, informatics is the science of how to use data and knowledge to improve human health and the delivery of healthcare services. The overarching theme of informatics is to bring the subdomains of data science, big data, health information management, and data analytics together into one to focus on improving health and healthcare. In simpler terms, Indiana University defines informatics as harnessing the power and possibility of digital technology to transform data and information into knowledge that people use every day. AMIA is a community committed to a vision of a world where informatics transforms people's care. AMIA aims to discover insights and advanced knowledge from healthcare's data to accelerate the transformation of health and healthcare. Basically, they want to advance the science of informatics through their programs, memberships, and information. AMIA is a nonprofit organization. With the help of memberships and donations, they prioritize the development of health informatics and science care through education and research. AMIA is a professional scientific association that was formed by the merger of the American Association for Medical Systems and Informatics, the American College of Medical Informatics, and the Symposium on Computer Applications in Medical Care in 1988. For more than 35 years, members of the association and the College, American Medical College of Informatics, have sponsored meetings, education, policy, and research programs. AMIA is the American representative for the IMA, which is the International Medical Informatics Association. The IMIA is a global association that promotes the furthering of information science in modern society, particularly in the fields of healthcare. Through education, training, accreditation, and certification, AMIA supports the current and next generation of informatic professionals. They provide members opportunities to grow professionally, foster collaboration and networking, and expand members' leadership opportunities. The AMIA supports 5 domains. The first is translational bioinformatics, which is the development of storage, analytic, and interpretive methods to optimize the transmutation of increasingly voluminous biomedical data into proactive, predictive, preventative, and participatory health. The second is clinical research informatics, which involves the use of informatics in the discovery and management of new knowledge relating to health and disease. Third is clinical informatics, which is the application of informatics and information technology to deliver healthcare services. Fourth is consumer health informatics, which is the field devoted to informatics in multiple consumer or patient views. And lastly, public health informatics, which is the application of informatics in areas of public health, including surveillance, prevention, preparedness, and health promotion. AMIA's programs and services are centered around 4 core purposes. They are to advance science and profession of informatics, promote the education of informatics, assure that health information technology is used most effectively to promote healthcare, and provide services for our members such as networking and opportunities for professional development. Going hand in hand with their core purposes is the association's vision statement. The role of the vision statement is to state the highest aspirations of the organization. The vision statement for the AMIA is the American Medical Informatics Association is the premier organization to advance discovery and innovation in the use of information in health and biomedicine. AMIA's core mission is to aim to lead the way in transforming healthcare through trusted science, education, and the practice of informatics. A mission statement is basically the organization explaining how they will go about accomplishing the purpose and vision. The overarching mission of the association is to be the bridge for knowledge and collaboration across a continuum from basic and applied research to the consumer and public health arenas. This mission plays into the core purposes I went over on the last slide. AMIA offers many different programs for members. From live educational programs, annual conference, and e-learning, there's a variety to choose from. One example is AMIA meetings. These are widely regarded as the world's most comprehensive meetings on biomedical and health informatics, providing a broad range of sessions on timely topics of informatics. Another example is AMIA's Clinical Informatics Board Review courses. This is an examination preparation program to assist physicians in becoming certified in the subspecialty of clinical informatics. Lastly, AMIA's 10x10 is their distance learning program. It is geared towards training the next generation of informatics leaders through an online program. Public policy is a large part of the association's mission. It is a huge part of how they accomplish their vision statement and promoting the advancement of informatics science. The main focus point of their public policy is to improve health in the United States and globally. They engage with policymakers and other thought leaders to improve health and healthcare with the use of informatics science, research, and practice. The association's public policy exists to improve the legislative and regulatory environment for health informatics research, practice, and education through member expertise. There are currently 9 pillars that AMIA identified as core to the public policy. They include patient empowerment, health IT safety, workforce and education, data sharing and research, health IT standards and interoperability, informatics-driven quality measurement, population and public health, health data privacy, and artificial intelligence principles for healthcare. So membership for the AMIA is a year-long commitment. Each year you would have to renew. They have a few different types of memberships with different price points and requirements. For a regular membership, it is $400 and is open to all professionals. For students, it is $50 and is open to any student in any educational program, not just health. For young informatics professionals, it is $220. This is for recent graduates, which is within the 18 months of, again, any educational program. Finally, there is a retiree membership that is $185. This is for retirees age 65 and up who have been regular AMIA members for at least 2 years. There are some benefits to becoming a member of the association. There are 4 benefits they list, which are connect, learn, grow, and lead. Connect is related to various conferences and committees that connect you with other members. Learn is in relation to the peer-reviewed publications and education courses offered that keep you up to date on the latest approaches to advanced healthcare. Grow means that volunteer opportunities and board certification programs are offered to develop your professional skills no matter what your career level is. Finally, lead is related to the presentation opportunities and recognition programs that help you become a respected leader within the AMIA and in the field. AMIA is made up of over 5,600 members. They are experts in the science practice of informatics as it relates to clinical care, research, education, and policy. These also include individual members, which can be clinical and health professionals such as physicians, nurses, dentists, translational and clinical informatics scientists, researchers, and educators, biomedical and health science librarians, advanced students pursuing careers in the informatics, developers, computer and artificial intelligence data scientists, government officials and policymakers, consultants, and industry professionals. The association offers educational and career opportunities that are broad and intensive. Informatics academic programs are able to search a directory for formal academic and training programs in biomedical, health, and nursing informatics and advance members' careers. The Career Center located on the association's website allows members to apply to jobs directly through the AMIA. The Clinical Informatics Subspecialty Certification is for members that are becoming board certified in clinical informatics and set the highest bar for those who are experts in this subspecialty. AMIA offers a variety of journals and publications, some open to members and others open to the public. JAMIA is AMIA's premier peer-reviewed journal for biomedical and health informatics. This is open for access only to AMIA members. The journal includes informatic articles from areas of clinical care and research to consumer and public health. The other JAMIA journal is JAMIA Open, which is open to everyone regardless of membership status. It is an online-only peer-reviewed journal that provides a global forum for the publication of novel research and insights in the major areas of informatics for biomedicine and health. Applied Clinical Informatics is an online journal available for AMIA members that is the official journal of the AMIA. The e-journal aims to establish a platform that allows sharing of knowledge between clinical medicine and health IT specialists. Finally, AMIA proceedings. The proceedings host an archive of previous conferences for members only. Some of the conferences include the annual symposium, the Summit on Translational Bioinformatics, and the Summit on Clinical Research Informatics in iHealth. The AMIA is the leading association in the United States for furthering the science of informatics and training future professionals in the specialty. They have a commitment to furthering education in the healthcare field and the advancement of informatics science. Through their commitment to their vision and mission statements, in the past 35 years, they have succeeded in teaching the next generation of informatic professionals in advancements in health and healthcare.